Hi, this is Travis Lindsay. We're here at the Tyler Internal Medical Clinic in Tyler, Texas, and we're talking to Amy today. And Amy is a medical assistant here at the clinic. And I know you mentioned, but what doctor are you working with here?
Thomas Busby.
Okay. How long have you worked for Dr. Busby?
4 years.
Is that right? Okay. Did you start specifically with Dr. Busby? Did you work somewhere else prior?
I worked here for Kevin May when we first opened.
Oh, okay. Okay. I remember
On.
Dr. May. Well, very good. And straight into it, obviously, you know, we're here to talk about Max products and your experience with. What was your experience with being introduced to the Max products and recommendations to patients and that whole process?
I started taking it about, April of this year.
Okay.
That's when I started.
And that was GXL?
Mm-hmm.
Okay.
You know, like I told you before, I was very skeptical because I'm not really into that kind of stuff as far as not believing a lot of those kind of things. But anyway, decided to try it.
Well, let me ask you this. Was there any particular experience that kind of led you to be skeptical,
No,
or just
because of the whole, if it sounds too good to be true, then it is kind of thing.
I understand.
Basically. After about 2 weeks when I started taking it, I didn't realize, not necessarily problems sleeping, but just not sleeping through the night, not feeling rested the next day. Felt like a new person as far as that. Energy-wise, I was a runner, or so was, still am. Was having difficulties with my knees, and it all went away.
Very good.
So.
And that was, you said, in roughly about 2 weeks?
Mm-hmm. Yep.
Okay. So have you started taking Max 1 now, or still?
I've been on it for 2 months.
Okay. Any appreciable difference with Max 1?
Definitely a huge improvement, which I wasn't real sure was even possible, but yeah.
Well, I felt the same way.
Energy-wise, for sure, definitely.
Okay. Any
stamina, you know,
yeah.
as far as exercise, working up here all day, big improvement.
Yeah. So what sort of day in terms of hours do you work for Dr. Busby?
We start seeing patients at 8 and finish about 4:30, 5 o'clock.
Okay, so pretty much a regular day.
Yeah.
But you're busy through that entire time. Yeah. Okay, very good. And obviously from your skepticism, I'm assuming you haven't, but have you ever referred with Dr. Busby any sort of nutritional product in the past?
No.
Okay, so this is definitely the first.
Mm-hmm.
Okay. And tell me, kind of, in your experience as you've been working with the product, you know, with Dr. Busby, how does that process work? Does Dr. Busby recommend the product to you, to both? How does that work?
Either way. Sometimes it's just from me pulling them in the room, and they'll mention, gosh, I'm so tired, or I'm having trouble sleeping, or, you know, we just kind of get into a conversation. And
okay.
sometimes, you know, he mentions it, the advertising on the wall, you know, it just kind of depends, you know,
okay.
Each patient's different.
So if you've got a patient that doesn't mention something like that, do you take it upon yourself to mention it to them and recommend it?
Yeah, just from knowing them and knowing their, you know, their kind of problems and things they do and
okay.
things like that. Mm-hmm.
Okay. Have you seen any, you know, negative, like reaction to the medications, anything negative on with the product?
Mm-mm.
Okay,
No.
very good. And tell me, because I think people would want to know, you know, what would be the most significant thing that you've seen? Is there a patient that stands out that, you know?
You've probably already heard about this patient, but
I may have, but there's a few that have been sprung on me.
Has not been able to sleep in the same bed with his wife.
Yeah, Debbie was talking about him.
That's probably the best, the absolute best.
Well, since he's been mentioned, do you have any others that kind of stand
just
out?
Just the same. I mean, it's just the same as far as I'm sleeping at night. You know?
Yeah.
I'm dreaming, and I've never done that before. The whole, if a patient's lose weight just because they're getting up and they're doing things, you know, not necessarily. They're moving. That's the thing. That's the big difference.
Okay.
Or them coming in and saying, you know, gosh, my back and knees are the biggest.
Yeah.
My back's hurt me for years. My knees, you know, I can walk now. I can actually walk to the mailbox and feel like doing some exercise. So.
Very good. Yeah. Now, outside of the practice and the patients, do you recommend it to family and friends as well?
Yep, okay. I've got my sister taking it, a friend of mine taking it, trying to scoop my mom in there.
Not always easy.
Yeah.
I understand.
But yeah, huge improvements. Even, you know, I have a 16-year-old that she's taking one pill a day, and it's, as far as her sleep, she was the type that gets up a lot, and she's sleeping better. And I thought, well, there's nothing in it's going to hurt her, so.
Well, exactly. Does she play any sports or anything like that? Has she seen any improvement?
That part she hadn't mentioned, but and then also my 13-year-old runs cross country, and they'll max the energy drink. Give it to him for the races, and he's talked about how the first race that he was in, he's in 7th grade, his coach couldn't believe it, because during practice he was lagging, and
Yeah.
he was shocked.
We have heard that.
Yeah.
Yeah, I've given it to many high school athletes. Didn't think that it would really have an effect on
Yeah.
at that age and with the energy drinks that they drink.
And I didn't tell him, I said, just take it, and it's just, a little drink. It's not an energy drink. I didn't tell him any of that, and he
Yeah.
took it. And
Yeah, I've started calling it a performance enhancer
Yeah.
because energy drink really doesn't describe it very well.
It makes you think of caffeine and sugar.
Exactly. And as you say that, I've asked some of the others, because, and I think it's good to say and kind of understand, but the product works in a different fashion in terms of the energy. Can you elaborate on that a little bit?
Well, as far as him, he was the best example because he's super hyper. Of course, he's 13.
Yeah.
And it didn't make him, he didn't have the crash, he didn't have the bouncing off the walls, the typical, there was energy there when he needed it.
Yeah.
He ran, 3-mile race, and it was there when he needed it. It was pretty cool.
Shut down when
Yeah.
you didn't.
No, it was pretty good.
Wasn't bouncing off the walls later at home.
That was a true test.
Very, very good. Well, good. Well, listen, I appreciate you taking the time to speak to us out of your day, and as always, appreciate it very much.